I'm Dr. Bojana Yankovic, and I'm here today with Dr. Katie Belesne, my dear friend and dermatologist, and we're going to talk about eczema, or eczema, which Dr. Belesne has reminded me we say in Canada, where we did medical school together. So what is this? So many people suffer from this. It's an inflammatory skin condition that can cause a significant amount of itching and can be debilitating for some people who have very severe symptoms. And the treatment can oftentimes also be frustrating and difficult to keep up with. So I'd like to first start by talking about what are some of the risk factors for developing eczema, and also what are some of the dietary things, if any, one can do to prevent or at least alleviate the symptoms.
Yeah, so risk factors, we know eczema, which I will call it, often is quite genetic. And so it happens and it runs in families where there's a history of atopy, and atopy being eczema, asthma, hay fever, and so those components. And so that certainly does play a role. In terms of other things, we see a lot of things that people can do that may exacerbate their eczema. So, for example, hot showers, not applying moisturizer, using very highly chemical or fragrance products that might irritate their skin. All those things can exacerbate it, but not necessarily trigger it. And then your first question about sort of foods or quote natural things that you could do for your eczema, there certainly is a lot of interest around that, and many people will come in and say, well, is it the gluten that I'm eating, or the fish, or whatever it may be. And lots of studies have looked at this, and there's never been shown to be a certain food group that triggers eczema. And so I can't counsel patients, cut out this food group and your eczema will be better. Having said that, there are patients who say, you know what, every time I drink milk or eat bananas or whatever it may be, my eczema flares, in which case, of course, try to limit whatever it may be that's triggering your eczema. In terms of the natural world, there's lots of research, I should say, going into things like omega-3, 6, the fish oils.
And they have so many benefits for other conditions
exactly,
as well.
And so eczema is being researched as well. Probiotics has got a lot of press, and certainly there's thought to be maybe a link there, and so that's being researched more in tea. So including all different types of teas, greens, blacks, that's being researched as well in terms of the benefit.
That's fantastic. That's interesting. Now, what about some of the other lifestyle factors like stress? How big of a role does stress play? Absolutely.
I often see my university or college students come in and their eczema is flaring because they're right around exam time, and we do think that stress plays a role in exacerbating their symptoms. Again, not necessarily causing it, but certainly that can get their eczema more flared at the time.
And in terms of what we can do when it comes to emollients or other treatments, what are some of the things and some of the products that you like to use and recommend to patients that are very effective as emollients?
Yeah, that's great. So, first things first, I always talk about even just like general skincare. So we talk about reducing the hot showers, reducing soaps. And so this is that thing where people overwash and cleanse their skins, and they're using these fragranced soaps, and it can really irritate or flare their eczema. And so minimizing soap. Only use soap where you're dirty. You don't have to use it all the time, right? And so that's another thing. Looking at reducing fragrance-free, hypoallergenic everything. I'll even recommend fragrance-free laundry detergents. Keep that off their skin. Perfumes and colognes, I'm just like, sorry, you got to cut it out for eczema. And so that's the first thing. And then emollients or hydration is absolutely critical for patients with eczema. And so I do recommend that they apply at least once a day. Usually something for an eczema-prone skin, you want something thicker. You want something more hydrating. And so often I recommend a cream or an ointment. So that's a little thicker. I tell my patients that anything in a pump bottle, like a lotion, is not going to be thick enough. It's too watery, and so they'll need something thicker. And a patient says, well, can I even use Vaseline, like good old greasy Vaseline? I'm like, yes, amazing. You may want to put it on and put something on over top because it'll get greasy everywhere, but that's very, very helpful for your skin in general when treating eczema.
One of my favorites is Aquaphor. I started using that when I started having kids, and I feel like just for little tiny patches that get irritated, it's like a dream.
Yeah, the big, the names that often come up, Aquaphor, Glaxol base. CeraVe cream is one that's probably a favorite of many of the dermatologists up here. It has ceramides in it, which is thought to help repair the skin barrier, which we think may be defective a little bit in patients who have atopic dermatitis. And so there's a number of very good products on the market. Aveeno, you'll hear about, all those ones. And so those are all options for patients. And mostly it's getting used to the routine, right? Like, you know, even anytime starting brushing your teeth, put on your moisturizer.
Right.
You know, you just need to get into the habit, because that's the hardest part of treating this condition.
And now when it comes to the next step in treatment, can you tell us a little bit more about steroid treatments as well as immunomodulatory treatments that can help?
Yeah, so the first step is often the topical therapies, like you mentioned, the steroid creams or ointments being common ones that we will use. They can be very effective. I think there's a lot of fear around steroids and thinning the skin, and I often have to counsel people to use more because I'll be monitoring their skin, and so it's you know, we need to calm down that inflammation. We need to put out the fire per se, and so we need to get people using these treatments effectively in order to actually treat their eczema. But people who don't want to use steroids or aren't finding effect, or depending on the area of skin that we're treating, we may use one of these topical calcineurin inhibitors. And there's a few different types, tacrolimus, pimecrolimus, and those are also effective. Moving up the ladder from topical therapy, there's things like phototherapy, which is a medical grade UV light that can be quite effective for eczema. And then, of course, there's systemic therapies or pills.
Yes.
Eczema is a very challenging condition to treat. I find that we don't have like perfect fit sometimes, but there are newer biologics coming up that could be quite effective, but they're still in the clinical trial stage.
Oh, that's exciting.
There's new things on the market for people with bad eczema.
Great. So stay tuned.
Yeah.
Well, thank you so much, Katie, for joining us, and thank you for watching.